From the Oregon State University Extension Service, this is Pollination, a podcast that tells the stories of researchers, land managers, and people like you who are making bold strides to improve the health of pollinators. I'm your host, Dr. Adoni Malathopoulos, Associate Professor of Pollinator Health in the Department of Horticulture. One of the highlights of my fall is attending the Oregon State Beekeepers Association meeting, which was held this year in Bend, Oregon. Incidentally, shout out to the Central Oregon Beekeepers Association for really helping host this meeting in Bend for the first time, at least that I can remember. This meeting is great for me because it's an opportunity to connect with beekeepers and hear what's going on with their colonies. In addition, I get to hear from some wonderful speakers, including our next guest. Dr. Sarah Wood is the University of Saskatchewan Pollinator Health Research Chair at the Western College of Veterinary Medicine. It's the only kind of position that I know in apiculture that's in a college of vet medicine. And Dr. Wood gave us some wonderful talks, amazing research that's done by her and her students. And one program in particular elicited a peppering of questions from our beekeepers in the state. And that was a program to monitor colonies in Saskatchewan for a disease called American foulbrood, using samples from honey. So in this episode, we're going to hear about that program. We're going to hear about how such a monitoring program can be used to really help manage a disease of honeybees in a way that reduces the reliance on antibiotics. So this week on Pollination, let's head over to Bend and talk with Dr. Sarah Wood from the University of Saskatchewan. Sarah, welcome to Pollination.
Hi, Andoni. Thank you.
Now, we are at the Oregon State Beekeepers Association meeting.
We are. It's been fun.
And you just gave a number of presentations, and I'm hoping to have you on the podcast a fair amount. Don't know how it's happened that we haven't had you on previously, but I did want to ask you specifically about what you talked about today, about a really great program that you're piloting in Saskatchewan around American foulbrood sampling in the honey for spores. So tell us a little bit. One of the ways that you set this up is that you were talking about the way in which in livestock systems antibiotics are used much more responsibly and targeted. Can you tell us a little bit about that to start with?
Yeah, so in other systems like dairy or swine, frequently we make antibiotic treatment decisions at the herd level. So we do pooled sampling of milk, for example, in a dairy to determine what the disease level is in the herd. And then we make a decision about whether or not we need to treat that herd with antibiotics. And so the parallel here is, could we take a pooled sample of honey from an apiary and decide based on the American foulbrood spore level in that honey whether or not we need to be treating those colonies with antibiotics in spring and fall?
And the way it was so great the way you set it up is because we really want to limit our use of antibiotic. But in some cases, when the disease, I think the way that you set it up is when the disease is outbroken in the colony, you should burn the colony.
That's right. So antibiotics are not effective against the spores of American foulbrood. If we have clinical disease in a colony, it is not appropriate to be treating with antibiotics. We need to burn that colony. But if we have spore levels at low level in our apiaries and we aren't seeing clinical disease, beekeepers are inclined to want to be treating with antibiotics to potentially prevent outbreaks of that disease. And so what we need to know is, what's the threshold? What's the number of spores in your honey where you're at high risk for clinical disease and should be treating to prevent that clinical disease?
And I was so impressed. You had a really elegant way of doing this. This is published work. And the other thing I was so impressed with is each slide that you had in your presentation had another student. Like, it was this amazing array of students that you're mentoring at the University of Saskatchewan. But there was a piece of work that was done where you were able to say, you said there's always some level of American foulbrood spores in honey, but that there's a level that seems to indicate a higher risk that it's in the operation. Can you tell us a little bit about the background for that?
Yeah, so this was work that was spearheaded by Michael Zabrodsky, who was a master's student in our lab, and Michael, and as well as Elamir Simcoe, who's my colleague that leads the bee lab. They did surveillance of honey of Saskatchewan beekeepers and determined the spore level in honey, and then looked at the incidence of clinical American foulbrood disease in those operations the next year. And what they found is that beekeepers that had 100 spores per gram of honey had a very high incidence of clinical AFB in their operation the next year. But in contrast, those beekeepers that had less than 2 spores per gram of honey had no clinical AFB in their operation next year. So this gives us some potential thresholds for beekeepers to make treatment decisions about whether or not they need to be using antibiotics.
Now, I can imagine honey is an easy thing to sample. You have it's a pool of many colonies. It comes through the line. But I imagine, it's if somebody has 1,000 colonies, for example, a representative sample might be a tricky thing. So what's your recommendation for how many samples to test to get a good estimate of what those levels are?
Yeah, so right now what we are doing is we are asking beekeepers to submit one sample from every 5th barrel of honey. So these are commercial beekeepers that are barreling their honey for sale. And we are asking for those samples at the end of their honey harvest, because at the end of the honey harvest, that's the furthest away from antibiotic treatment in the spring.
Fantastic. Okay, so the samples come in, and then you culture them. And the one thing I also was really impressed with, it doesn't only tell you that when you take the honey, you take it into the laboratory, you culture it, and you figure out how many, essentially you're estimating how many spores are in the honey. But after you do this, you're left with a culture that you can also determine other things from, like resistance to antibiotics. Tell us about that.
Yeah, so this is the work of Alexei Obsta, who's a PhD student in our lab, and he had 718 isolates of Paenibacillus larvae from these honey samples, and he tested their sensitivity to oxytetracycline. And what he found was that about 9% of those samples were resistant to this antibiotic. And so those beekeepers would need to be using another antibiotic, such as Tylazin, in order to control AFB in their operation. And the other interesting thing is we know where those samples originated from, so we can plot on a map where the resistance is in the province and hopefully mitigate its spread.
Okay, fantastic. I guess, at the end of the day, this is a great way, it seems like, to use antibiotics to be able to keep disease levels down when you need it. But it also just brings focus on antibiotic stewardship and beekeeping. Can you just kind of maybe we can conclude by just laying the stakes for why beekeepers need to be careful with using their antibiotics?
Yeah, so we've been using antibiotics in beekeeping in North America for over 70 years. And in contrast, it is illegal to use antibiotics in beekeeping in the European Union. So if we're going to continue to justify our use of these drugs in beekeeping in North America, we need to show the evidence for why we need to use them. And so that's why monitoring spore levels in honey can be a really good evidence-based tool to make decisions about when we need to use these drugs. And the stakes are high. We know that about close to 5 million people every year worldwide are dying from infections that are untreatable with antibiotics due to antibiotic resistance. And so if we want to minimize the number of people dying from antimicrobial resistant infections, we need to be using less antibiotics so that we're not selecting for these resistant bacteria. And so I think as beekeepers, we can all do our part to only use antibiotics when they're necessary, and that way we can protect the efficacy of these drugs for future generations.
Fantastic. It was a real pleasure hearing your talks here, and I'm looking forward. I think we're going to meet up. We're going to be on the same ticket in Calgary at the I can't remember what it is. It's the CHC annual meeting, but it's kind of a new revamped imagination for the CHC meetings, from what I understand. So if you are a Canadian listener, make sure to come to the conference in Calgary in February, which is, it's Calgary in February.
Yeah, I'm looking forward to it, Andoni. I'll see you there.
Thank you so much for listening. Show notes with links from each episode are available at the website pollinationpodcast.oregonstate.edu. I also love hearing from you, and there's a form at the website where you can pop in and say hello and give me feedback. If you want to support the show, remember to leave a rating on iTunes, Spotify, or whatever podcast mothership you use. And finally, if you have the means and you want to help support my lab's effort to document bee biodiversity in Oregon, visit OregonBeeAtlas.org and follow down to the donate button where you can make a tax-deductible donation to the Jerry and Judith Paul Native Pollinator Endowment. Every little bit helps. See you next episode.